Hi, it's Carmen. Welcome to my channel on living with rheumatoid arthritis. Today I wanted to do a video on the drug prednisone. I was prescribed prednisone when I was very first diagnosed with rheumatoid arthritis in 1995, and I have been on prednisone, oral prednisone, consistently for these last 20 years. So I wanted to talk to you about some of the short-term side effects, the side effects that happened fairly quickly when I first got on it, and then I wanted to talk about some of the long-term side effects that I'm experiencing now. Also, in researching for the long-term side effects, I became aware of more side effects that can occur when you're using the drug for a long time, so I was going to list those also. And I will put some links to studies in the information box below if you want to read more about some of those side effects. Most people, when they have an inflammatory condition, when it's acute, prednisone is often prescribed because it is so good at bringing inflammation down. And for us, inflammation is so damaging to the joint that doctors want to get you on something that's going to reduce the inflammation fairly quickly. And it takes a while for other drugs like the DMARDs and biologics to start working, sometimes up to like 12 weeks. And so commonly doctors, rheumatologists will prescribe the prednisone while they are trying to get your symptoms under control with other medications. The problem is that a lot of us then do not ever get off of the prednisone. In my case, when I first was diagnosed, there was no biologics on the market for rheumatoid, so I was trying different DMARDs like Plaquenil, sulfasalazine, methotrexate, I can't remember, cyclosporin. Anyways, but none of those drugs worked for me, so it just ended up that I was on prednisone longer and longer and longer, and then eventually that just became my maintenance medication, the non-steroidal anti-inflammatory, and together with the prednisone and sometimes the methotrexate. But I didn't tolerate the methotrexate well, so I wasn't on it only for short periods of time when things really got bad. So I've been on oral prednisone anywhere from 10 milligrams to 30 or 40 milligrams. I would get prescription for 5 milligram pills, and when I would see my doctor, I'd usually be at about 15 or 20 milligrams a day. And he gave me the flexibility to go down if I was feeling better, or to increase for a week or two if I was really feeling poorly. So, you know, sometimes I would go if I knew I was needed to, you know, accomplish something at work, or if I was going on vacation, I would start increasing the prednisone up to 40 milligrams just so that I could feel well enough to accomplish whatever it was, and then I would taper back down. When you're up there at those really high doses, you can taper down quite quickly by 5 milligrams, you know, every other day for a week, and get back down within 3 weeks. You can get back down to like 15 or 20 milligrams. It's when you start to wanting to taper lower than 15 milligrams that it becomes more technical, and there's definitely protocols for reducing once you get to that point. So I'm going to make another video about those protocols in reducing prednisone. So anything that I say in this video about side effects, some of them are fairly serious, and you might feel really motivated to get off your prednisone, but you don't want to go off your prednisone without your doctor's permission and guidance. There's just a lot of warnings against that. So some of the side effects that I experienced right away at which they call the short-term side effects, And when they say short term, I also wanted to define that. When you're looking at studies and they say short term use, they're talking about 3 weeks or less. And when they're talking about long term, they're talking about a month or more of use. So when you've taken it for 5 years and you're trying to research what the side effects are going to be, it's hard to find studies that are going for 5 years. You might find some studies that are going for about a year and some of the effects of that, and but not generally, you're not finding, you know, people who have used it for 5 years. There's some studies out there, but it doesn't really matter because the long-term side effects start to occur after even a month of use, and especially after a year of use. So I can still tell you what they are. If you've been on prednisone 5 years, and you can expect that you're going to start experiencing some of these side effects. They're also in the studies talking about the dosage when they start to get into defining adverse events. So low dose is considered 9 milligrams or less a day, and high dose is considered 10 milligrams or more a day. Some studies have a medium dose, which is 10 milligrams to 19 milligrams a day, but it's kind of meaningless when you're researching side effects. Either it's that low dose category or the high dose category. And that's talking about oral use. There's lots of ways that they get prescribed prednisone. It comes in different forms. We can take it orally in pills. We'll often, with rheumatoid arthritis and other types of arthritis that affect the joints and swelling in the joints, you'll get cortisone shots in the joints. You get cortisone shots in the soft tissues and muscles. You can get eye drops if you're having an inflammatory condition in your eye. Steroids come in inhalers for people with asthma. It comes in creams for skin conditions, and I think that's, oh, and nasal. You can get nasal sprays for if you have allergies that are steroids. So they're widely prescribed. It was in 1940 that a researcher developed prednisone, and it was considered such a miracle drug for so many inflammatory conditions that he actually won the Nobel Prize. It wasn't until later that they really discovered the horrible long-term side effects for people. So your doctor's probably going to prescribe it. Hopefully your doctor is going to be really good about getting you off of it as soon as possible. I can't really blame my doctors that I've been on it so long. It's just that I didn't have good response to other medications, like I said, for a long time. And so there was no chance of getting off of it. And also I was adamant about living my life as much as I could. And I figured when I would experience the long-term side effects, I would just cross that bridge when I got to it, because I needed the drug to just engage in daily life, to go to work and raise my son. So I was kind of pushy about staying on it, let's just put it that way, because it's not a pain reliever, but because it reduces inflammation, it also reduces pain. So I mean, I could care less if a joint is swelled up, but if it's causing so much pain that I can't work or function or drive or cook, you know, I'm going to take the prednisone. So in that first year, I got many cortisone shots in the joints. Probably the first 3 years, I got quite a few shots. And the idea on that was that through studies and experience with using cortisone for professional sports people, they found out that giving them shots all the time, anytime they had to play a game, was really harmful. But they found that if they only received shots quarterly, that there was way less side effects. So that's what me and my doctor were going by, and every quarter I'd go in and get shots in whatever joints were bothering me. So I had quite a bit of shots. Anyway, so the short-term effects, right away, you in the first couple weeks, you get weight gain. And I believe that that is because taking the prednisone sort of hypes you up, and it also raises your blood sugar, and it causes insomnia. So for all those reasons, we're like eating more, trying to regulate how we feel, I think. And so it definitely makes you gain weight. It also causes redistribution of weight gain, so that you're gaining weight in the trunk and in the face. The moon face is common just even after 3 weeks, and more common if you're using really high doses for 3 weeks, like I'd say over 30 or 40 milligrams. You see people who maybe go into the emergency room for something inflammatory condition, and they just really high dose them, and you'll get the moon face right away. And in my experience, that's a short-term side effect, but it continues on, and it doesn't go away until I think you have to get under 5 milligrams a day for that to go away. And let's see, so yeah, insomnia, and also a short-term side effect is bone loss. And I think sometimes we hear about the bone loss, and our doctors say once they prescribe you prednisone, they say, you know, they want you to start taking calcium, and it seems kind of vague, like, oh, you know, you don't really think that bone loss is going to occur right away. You think that's something down the road, but actually studies have found that after 3 weeks of high dose, meaning over the 10 milligram, prednisone use results in bone loss. And it mainly is resulting in loss in the spine, in the vertebrae, which eventually leads to fractures in the spine, which are very painful and start to cause deformity in the spine. The studies that I'd read show that if you actually do stop at 3 weeks or start tapering back down after 3 weeks, and say you're off the prednisone by 6 weeks, some people, there's a certain percentage of people that will gain that bone back, but only a small percentage. The rest of us we experience the bone loss fairly quickly, especially in the first year. Also, if you go in, you'll go in and get a DEXA, I think it's called, where you're in the bone density machine, and doctors make a lot of money on that machine, so they'll try to get you in there. If you can get in there before you start prednisone, it's a good idea, because like I say, the bone loss occurs so fast that if you wait for a year to get your DEXA, to start a baseline of where you're at, you're already past the baseline. I mean, you already missed it because you're already having bone loss in the first year. So I did have bone loss on my first DEXA. I was in the range of Osteopenia, which is the range right before osteoporosis. And that happened to me when I was in my early 30s, like 31 years old. So it's 20 years later now, and I had one other DEXA a few years ago, and it did show some increased bone loss. But I'm not really willing to get those DEXAs anymore, because it doesn't matter. I mean, it matters, I guess, if it helps motivate me to get off the prednisone, but otherwise, it's not that informative. You know you're having bone loss if you're on the prednisone. And they find that females have more bone loss than males, and that's a hormonal thing. And then females are going to have even more bone loss after menopause because of the loss of estrogen. So it's really quite serious, because as you get older, if you experiencing fractures is very dangerous, and especially when it's in your spine. But you can experience fractures in your hip, and you've heard of people that happens to, and they lay on the floor, they can't make it to the phone, and they can die. So it really is a cause of it's in the top 10 causes of death is bone fractures. Anyways, so that's all the short-term side effects, really. And I'm assuming that they're fairly reversible, but I don't know, because I never did quit prednisone. And so those side effects have stayed with me. The kind of hyperactivity and the blood sugar thing, I mean, I really have to monitor what I eat, that I'm eating proteins to try to keep my blood sugar levels somewhat normal. As far as the insomnia, always take prednisone in the morning. That's the time that the body naturally produces cortisol, is early in the morning. And so since we're taking over that function by taking prednisone in much higher doses than what our body produces, we want to take it in the morning, because as you start to taper off, it's really difficult if you're taking a morning dose and an afternoon dose. So even if you're tempted to split your dose up, I would really talk to your doctor, and if your doctor's recommending an evening dose, I would consider another doctor. That's how much that is a well-known fact, that it's better to stay on prednisone just once a day and in the morning. So I'll talk about that again more in my next video on tapering off of prednisone. So the long-term side effects, and this is a lot of the studies, I'd say, were like at the year mark and 6-month mark that I was looking at. So even though long-term is considered more than 3 weeks or a month, I'm talking at like a year interval is where you're likely going to experience some of these side effects, and then it just kind of gets worse as the years go by if you stay on it. So more bone loss and bone softening, and that's a big one. Myalgias and weakness, muscle weakness. So for me with the rheumatoid, after, I'd say when I reached about the 10-year mark, I was having so much myalgia in my muscles that I seriously, I didn't know what was happening. I just felt like the disease was progressing in a way that I never had imagined. I didn't know that. I thought rheumatoid really was going to just stay with the joints, but it starts to affect all your systems, and for me it definitely was causing myalgias and bursitis and weakness. But prednisone on its own also has that side effect. That's listed as one of the long-term adverse effects, is myalgias and weakness. And the weird thing, and I find this with prednisone, is that prednisone can be causing myalgias in the muscles, and then when you complain of myalgia in the muscle, they give you cortisone shots. So they give you the exact drug that could be causing the problem, but it also cures the problem short term. So what can you do? It increases your blood pressure over time, and that's a danger for heart disease. It causes edema, which is the collection of fluid, generally in the legs and in the hands. But also it can be a sign that you're collecting fluids in your lungs. So if there's any edema, your doctor will probably give you a chest x-ray. I know my doctors, over time I've had different doctors, and they all have done chest x-rays, just looking at the lungs, looking at the heart. So I think they are looking for that fluid in there. Prednisone causes GI distress. It causes GI bleeding, ulcers, and I didn't really know that. I knew that the non-steroidal anti-inflammatories, which there's many, so I won't even name them, but they definitely over the long term are going to cause ulcers. Pretty much it was 100% they're going to cause ulcers and stomach bleeds, but now that they have come out with the proton pump inhibitors like the omeprazole or Prilosec, hopefully you're taking one of those if you're on non-steroidal anti-inflammatories and if you're on the prednisone, because you're going to have GI problems eventually. Cataracts is another side effect. I was diagnosed with cataracts in the first year of prednisone use. I think I had gone to an eye doctor to get a baseline because I was going to start Plaquenil, which is a drug that can cause some eye problems, some vision loss. And when I went in for that appointment, was diagnosed with drug-induced cataracts. They're a different type of cataract than an aging cataract in the eye. Anyways, I didn't know really what that meant. Every year I'd go back to the eye doctor and they would just say, oh yeah, there is still there, tiny, small, no problem. And it was about 10 years into prednisone use that one day I was out driving in the sun and I felt like I couldn't see other cars. And then some night driving later that week, I felt like I couldn't see the signs and I couldn't see the cars and the lights were overwhelming. And it was such a strong experience. I was really worried and I got an emergency appointment at the eye doctor. And I wasn't even thinking about those cataracts. I really didn't know what the problem was. But it was the cataracts. They had just grown like overnight. And the eye doctor told me that that is the nature of prednisone-induced cataracts, is that they can stay quite small for a long time and then just very quickly escalate, and then you have to get lens replacement. So I didn't know that. I thought that I would have time, and as they started growing, I could reconsider taking the prednisone. You know, I was always trying to weigh the benefit and risk of taking the prednisone, and maybe had I known that those cataracts could just explode overnight like that, I might have been more cautious and taken less. I don't know. So the cataract surgery was a big bummer, and I lost a lot of vision getting lens replacement. So I won't get into that, why that occurs, but if you're younger and you have to get lens replacement, you're going to lose vision. It's not like you're 70 or 80 and your lens has already hardened and you're getting it replaced, which then most people will say they've got vision restored. I felt that I lost vision when I got my lens replacement. So cataracts is, I think, a big deal. Dental caries and gingivitis is also common when you're taking prednisone. It's also common with autoimmune disorders. So it's hard to find it in the literature, but it is there. And even your dentist, my dentist in the past, I've had to educate them on that issue, because they'll say, oh, you have gingivitis, you need to take care of your teeth more. And I'm like, well, I've been on prednisone, you know, for 10 years, 20 years, which is harming my immune system. And also the rheumatoid itself is harming the immune system. So I just had to, I've tried to get in and see my dentist twice a year. Sometimes I could only afford once a year, but to get the deep cleaning, to brush and floss really well. And then they also, there's a mouthwash that does have, it does have medication in it that will kill the bacteria that you can occasionally swish with. It's not good to use all the time, but I can kind of tell when things are getting out of control in my mouth, and I'll use that mouthwash, which I get from my dentist. And I'm sorry I don't have the name of it, but if you ask your dentist, they'll know what it is. So yeah, the gingivitis. Also, with the bone loss, you'll get bone loss in your jaw, which will cause your teeth to become loose. And so that's caused by the prednisone, the bone loss in your jaw. So a lot of dental problems can come in the long term. And the gingivitis started, I think, 2 years after I was on prednisone. So thinning skin and muscle atrophy is another long-term problem for me, and I think this is where it's going to start, is on the forearms. You'll get the heavy bruising on your forearms. It's called purpura, and I'll put a couple photos in here so you can see. This It's been happening to me for a couple years now, where I could barely brush my arm against something or not even be aware of brushing my arm against something, and I'll get these purple bruises that take 3-4 weeks to heal, and by then I've got more bruises from knocking around my arms. So it's unsightly, and it also eventually the skin will become so thin that it will just crack and break, and so it's a problem. And if you stop taking prednisone, it's my understanding that it will slow that process of skin thinning, but it won't reverse it. Your skin is not going to get thicker and repair itself. Now, part of that happening on the forearms is also muscle atrophy under the skin, soft tissue atrophy right under the skin there. So I brought it up to my rheumatologist, and she doesn't seem concerned about it. When I go in to get my Remicade infusions, the infusion nurses, since they're looking for veins and looking at my arms closely, they seem to be more concerned about it. So that's happening with the forearms, and it's not very fun. And the final thing that I wanted to, there's 2 things actually, 3 things. The one is dementia. So you can see I'm having a moment of lack of remembering what I was going to talk about. I was surprised when I started to study for this video that dementia is drug-induced dementia, prednisone-induced dementia is quite serious, and it's so serious that it can be a differential diagnosis from Alzheimer. So someone can present to their doctor with all the memory loss and things, the dementia symptoms of Alzheimer, and it can actually be prednisone. And I think that that's at higher doses, higher than 10 milligrams. I'm thinking like in 40 or 50 milligrams, or if someone's been in a acute situation in the hospital and they've been given, just really high doses of steroids, they can have this drug-induced dementia that mimics Alzheimer. So it causes deficits in verbal memory, in concentration, in executive function, so decision making. It can start to harm decision making, and it shows deficits in academic performance and professional performance. So I know when I was in about my 15th year of rheumatoid, I felt I couldn't concentrate at work. I was making mistakes that I would find, later in the week. I couldn't remember, certain phone calls coming in. And I just felt it was because I was feeling so poorly and having so much pain, and my rheumatoid really wasn't being managed very well, and I was so tired that even though I was working part-time, I felt I wasn't effective, and actually I wasn't a very good employee at that point. And I didn't know that prednisone could be causing some of these problems. I had no idea. I just thought it was the disease itself. And so I was glad to read that actually prednisone can cause some of that. And I do believe that some of that is reversible if you stop taking the prednisone. And I'll have to look at the study again, but my notes here say that some of that is, especially when it's all the way to, as much dementia as Alzheimer, it does, when they take the drug away, it does improve. So that's a big deal in long-term use. And diabetes is also something that occurs with long-term use, and I'm talking like a year or more. Like I said, it already right in the beginning will cause high blood sugar, and that constant production of high blood sugar can lead to diabetes. And then Cushing disease or adrenal dependence is also another long-term side effect, and you can look up Cushing's disease to see it's a disease on its own, but it can be induced by prednisone use. And what happens is, to the best of my understanding, is a normal functioning person their body will produce cortisol in the morning, like I said, at measurements anywhere from like 7 to 12 milligrams in the system. That cortisol will tell the hypothalamus that it's in the body, and then as it wears down in the evening and into the night, the hypothalamus will notice that there's not enough cortisol again, and it will signal the pituitary, which will signal the adrenals, and the adrenals will release again that small amount of cortisol that's needed in the body. So if we are taking more than 10 milligrams of prednisone, that system is being bypassed. We are putting the cortisol basically into the system, and there is no signaling to the adrenals to release it. And after years of that, the adrenals can become non-functioning, and you become steroid dependent at that point. And that is all part of Cushing's disease, where the adrenals are no longer producing cortisol. So that's why when you get to 10 milligrams and you're tapering off, it becomes very serious how you go about tapering off at that point, especially if you've been on a long time. It may take some time for the adrenals to wake back up, and it may be that they won't wake back up. So I'll talk about that again in the next video, but that adrenal dependence can also be called Cushing's disease. Okay, so those are the short-term and long-term side effects. Right now in my life, I'm down to 8 milligrams of prednisone. I'd say I was down to 10 for about 2 years, and I've been working really hard to get down farther. I kind of came to a stopping point at 8 because when I try to reduce anything lower than that, I can't hardly get out of bed. I'm so tired, and but I think with being on the Remicade is helping me some, and I'm on a lot of other medications. For me, I feel it's just time. It's really time for me to get off of it. I do take calcium. I'm not religious about it. I should be. And vitamin D and aldronate, I think it's called. It's Fosamax. And so definitely you'll want to be on those, you know, the calcium and the Fosamax, which helps build bones. But it's not going to help with these other side effects. I've never heard of any other. I mean, my doctor hasn't said, oh, you can take this medication and it will help with the prednisone dementia. You know, I haven't heard that. So I'm ready to get off of it, and I'll keep you posted on that. My camera just ran out of power, so I'm recording this very last ending with it plugged in. I got a new camera. I'm not really sure how it works. This is my first go with it. So anyway, thank you for joining me. I hope this video is informative for you. And again, please don't stop taking your prednisone or start reducing it without talking to your doctor. And I will make another video on tapering. And please rate or comment, subscribe if you'd like to get notices of future videos that I've done. If you just hit the little subscribe button right below the YouTube video, then that will put you on my mailing list for new videos. So take care. Hope you're well. Bye-bye.